Welcome to Project First Line. Thank you for joining us. Today, we'll discuss where germs live in healthcare environments and how understanding these areas can help with infection control. You'll also learn how to anticipate when there could be risk for germs to spread so you can take action to keep it from happening. Throughout this training and in all other Project First Line infection control training modules, the term germ refers to bacteria, fungi, or viruses that are likely to pose challenges to infection prevention and control. Germs are part of everyday life. The world is covered in germs, especially in healthcare. When we think about where germs live in the healthcare environment, there are four major reservoirs. The four core environmental reservoirs are water and wet surfaces, dry surfaces, devices, and dirt and dust. These aren't the only places where you can find germs in the healthcare environment, but we'll focus on them for our discussions about infection control because they are common sources of spread. The definitions of these reservoirs are mostly self-explanatory, so today we'll discuss why they're so important and how we can use our knowledge about them to recognize the risk for germs to spread. Each environmental reservoir has an impact on our daily work lives. We'll explore some of the more obvious risks of each of these reservoirs, as well as some that might not be so obvious. Let's start with water and wet surfaces. Water is used a lot in healthcare and in many different ways. Although tap water is safe to drink for most people, it isn't sterile. Because most water and wet surfaces are good places for germs to grow, it's important to be careful with water in healthcare. Germs can grow in water and spread in several ways: through touch, when medical instruments get wet, by splashes or sprays onto skin or equipment, and by inhaling water droplets that carry germs to the lungs. Now that we've discussed the risks of water and wet surfaces, let's explore actions to address them. Think about how you interact with water and wet surfaces in your workday, like toileting, cleaning, and bathing. Infection control actions include cleaning and disinfecting surfaces, sterilizing devices, washing hands, and using PPE like gloves, gowns, and eye protection. Now, let's talk about dry surfaces. Germs from the body, air, and stool can easily spread to dry surfaces like bed rails, door handles, countertops, and bed curtains. Hands can transfer germs to other surfaces or people, and devices can pick up germs from dry surfaces, spreading them when used on or in patients. Common healthcare actions involving dry surfaces include using medical equipment, handling supplies, and touching high-touch surfaces. Infection control actions to prevent germ spread from dry surfaces include routine cleaning and disinfection of surfaces, sterilizing medical devices, cleaning hands, and using PPE. Let's move on to dirt and dust. Germs in dirt and soil usually don't make people sick, but they can harm patients with weakened immune systems if they enter healthcare facilities. Outdoor construction or indoor renovations can send dirt and dust into the air, which can spread germs that may be inhaled or transferred by touch, especially to surfaces and devices. If these germs reach central lines or wounds, they can cause infections. Have you ever thought about the potential risk for germs to spread from dirt and dust and what actions will keep these germs from spreading? Infection control actions you can take to prevent germ spread include ensuring good ventilation, cleaning and disinfecting surfaces and devices regularly, cleaning hands, and using barriers and other construction containment. Now let's talk about the final environmental reservoir, which is devices. Devices, equipment, tools, and supplies can all carry germs. Healthcare workers use and share them frequently, making them infection risks. Medical devices like stethoscopes, blood pressure cuffs, IV needles, endoscopes, and artificial hips are used on or in patients. Germs can spread through devices by bypassing the body's defenses. When devices are used on or in a patient, germs on them can enter the body. Devices can also pick up germs from the patient and transfer them to other surfaces or people if not handled properly. Germs can grow on devices like artificial hips if not managed correctly. To prevent this, regularly clean and disinfect devices, sterilizing those that are considered high risk, clean hands, and use PPE like gloves. We've covered a lot in this module, so let's take a moment to bring it all together. Reservoirs are the places on and in our bodies and in the environment where germs live. Germs frequently spread between and among these reservoirs. 4 reservoirs in the healthcare environment are important for infection control are water and wet surfaces, dry surfaces, dirt and dust, and devices. Understanding where germs live helps us recognize where there is risk for them to be spread and why infection control actions work to stop them from spreading and making people sick. Thank you for your time and attention today. I hope that you can take these ideas and apply them at work. Even though we covered a lot today, there is still much more to learn. You can keep exploring these topics on your own using the resources in this module. Project First Line has a suite of products to help you learn more about how to recognize infection risks at work, where germs live in healthcare, and how germs spread. You can also follow Project First Line on social media.